Hey guys! So today my group and I are going to be informing you about a very awkward yet still very serious type of cancer, testicular cancer. I know, it's pretty awkward, but I hope we can all be mature enough to understand the importance of this because it might affect somebody that you care about. So let's get started. First off, let's talk about what this cancer is all about. Testicle cancer is cancer that starts in the testicles. To better understand the cancer, it helps to know the structure and function of the testicles. Testicles are part of the male reproductive system. They are normally smaller than the size of a golf ball in adult males and are contained in a sac of skin called the scrotum, which is located beneath the base of the penis. The testicles have two main functions. They produce male hormones, such as testosterone, and they make sperm, the male cells used to fertilize a female egg cell. Now you're probably wondering, does this just affect the testicles? No? Well, now you are. And the answer to your newfound question is no. Normally the effects are mostly in the testicles, where some might experience either a lump or swelling in the testicles. Not to freak any guys out, it is normal for one testicle to be larger than the other, or one of them to be hanging lower than the other. So just be aware of any changes throughout your lifetime. Some men might also experience a feeling of heaviness or aching in their lower abdomen or scrotum. They also might have some swelling in their lymph nodes, which are small structures that work as filters for harmful substances. If the cancer happens to spread to the liver, they might have some belly pain. If the cancer happens to spread to the brain, they might have headaches and/or confusion. If the cancer happens to spread to the lungs, they might experience some chest pains, coughing, and even coughing up blood. What are the chances of you or a loved one getting this? According to the American Cancer Society and the National Cancer Institute's surveillance, they say the chances are very low. The ACS said this year in the U.S., 8,430 people will be diagnosed with the cancer, and 380 people will die from the cancer. The National Cancer Institute surveillance said that between 2003 and 2009, they had some percentages based on the 5-year survival rate in different areas that depend on the testicular cancer. For the localized stage, which means that it stays in the testicular area, it was 99%. In the regional area, which means it's still in the testicles, but it did spread to some other lymph nodes and tissues in the other area, it was 96%. For distant, which means that it spread to other organs, it was 73%. The 5-year survival rate is based on the 5 years after the person has been diagnosed. Doctors look at people who were diagnosed 5 years ago and see how their treatment went. Times have changed and the medicine has changed, so people that are diagnosed today have a better outlook than 5 years ago. Survival rates are based on previous outcomes in large numbers, but they cannot predict for a single person's diagnosis. Other factors might come into play, such as the person's age and how the cancer responds to the treatment. Well, that's it for me. Take it away, guys.